Did you know that healthcare is one of the largest and fastest growing industries in the country?
The healthcare industry needs you.
Bright, energetic young people.
Hospitals are where people with many skills and backgrounds work together.
So what kind of jobs do people do in hospitals?
The healthcare we provide here at the medical center requires a team of people working together. It involves nurses working with doctors, working with social workers, working with respiratory therapists. We also are an organization that has job opportunities for many other individuals who provide business functions, clerical functions, environmental service functions. Here at the medical center, we have a huge complex of buildings. We have many folks that work here, electricians, people that work in facilities, people that work in our business office and do a variety of accounting, clerical, other kinds of administrative functions. So there are so many opportunities in healthcare as well that aren't specific to some of the what people often think about is the care providing healthcare disciplines.
Hospitals are happening places.
So let's take a closer look at some of these careers. Why did you become a nurse?
I became a nurse because I felt like I could be a good caregiver. That's what brings me back every day, the patient care, meeting the people, taking care, knowing that I could help someone to feel better.
What have your career path been?
I was a patient unit secretary here at Strong, and I did that for 6 years, and then I became a patient care technician. I did that for 6 years, and while I was doing that, I was going to school to be a nurse.
What do you like most about your job?
The patient care, especially post-op patient care, because you're here for days and days and you get to know them.
What advice would you give a high school student?
To talk to your high school guidance counselor or maybe some friends or family members that work in the healthcare field. Maybe do home health care. That helped me a lot. I was a patient care tech before I became a nurse, and that helped me a lot in deciding whether or not I could do this or whether or not I wanted to do this.
Why did you become a PCT?
I felt that by becoming a PCT, a patient care technician, it would better prepare me for a career as a registered nurse.
Can you describe your career started out here at the Strong Memorial Hospital?
Sure, I started off as a secretary. I worked as a secretary for approximately 2 years. And from there, upon entering nursing school, I secured a position as a patient care technician. And I've been able to take advantage of the support resources such as tuition reimbursement and mentoring.
What advice would you give somebody that wants to become a PCT?
Definitely be dedicated, have a goal and a plan, and you have to be compassionate and have a sense of motivation in doing what you're doing.
What are 3 things that you enjoy about your job?
Oh, direct patient contact, the experience, and I love being able to make a contribution to the health of other individuals.
And where would you go from here?
From here, I see myself completing my education, attending the University of Rochester's accelerated nursing program, and becoming a registered nurse within a year's time, and from there becoming a nurse practitioner.
What career opportunities are there becoming a nurse?
There's several different ones. Hospital nurse like I am in an acute care setting, nurse practitioner, school nurse, doctor's offices, home health care, all sorts of opportunities. It's a never-ending field to always be employed. It's what we all say.
We test everything that comes in the door that has anything to do with the patient. heart-lung machines, pumps, IV pumps, anesthesia machines, ventilators.
Can you tell us why you wanted to become a biomedical engineer?
I became a biomedical engineer because I like the medical field and I'm interested in the medical field, and it's always advancing, and I like to fix things and help people.
Clear. We're all clear. All right, stop.
This is a medical simulation center. We use the high-fidelity simulator, which is a full-size mannequin that's controlled by a computer. And we use this device to train medical students, residents, practicing physicians, nurses. When I was in high school, I was good at math and science, and I wanted to pursue a career in the medical field. And when I got to college, one of the majors that interested me was biomedical engineering because it actually bridged math and science and the medical profession.
What kind of advice would you give somebody who wanted to become a biomedical engineer?
Focus on their math skills and their communication skills.
Try to shadow some biomedical engineers in their area and see what they do if it interests them, because there are a lot of different tracks. Biomechanical engineers, they work with implants. Bioelectrical engineers who work with devices like monitors, defibrillators. You have bioinformatics engineers who deal with information systems within the hospitals.
What do you enjoy about working here?
I enjoy working with the people. There's a lot of nice people. I enjoy learning the new technology that comes out.
The things that I enjoy is that when I work in a clinical environment, I enjoy helping physicians provide better care for their patients. I enjoy the challenge of applying my technical skills and my knowledge of physiology and some knowledge of medicine.
No pulse. Oh, wait.
I'm called clinical nephrologist technologist, or a dialysis technician. People get on dialysis when their kidney fail and they need something to help process their blood, to clean it out. What I do is I set up the cyclers, like this is one.
What advice would you give a high school student that's interested in a health career?
Come to the hospital, to shadow, like a nurse or a technician, that way you get more experience. Like say you want to be a dialysis technician, you come in, they'll take you around the units, they introduce you to the patients, you can see the different procedures that's going on. You get more like a hands-on.
What do you enjoy most about your job?
I like, meeting different people, different personalities. I like talking to them. You get to meet the whole families, things like that. So that's why I enjoy working with people.
Where do you see yourself going?
I've been a technician for, 8 years now. So I see myself being a nephrologist, actually continue on my education, going to med school and actually doing more since I got the hands-on part of it, from the ground floor. Now I want to be a doctor so I can help the patients more.
It's a good place to work. I like it here.
We get to see the crossroads of the university. We have to be very detail-oriented and have a good memory. We must have a memory bank. I'm here 28 years of about 5,000 names.
I started off in dietary, and after a couple of years in dietary, because I wanted weekends and holidays off, I had 2 small kids at the time, transferred over to the post office, and I loved it.
I like the hours that the university offered, Monday through Friday. A lot of hospital jobs are around the clock and they're different, so for me it worked out well with family. Also, my son used the tuition benefits from the university to go to school, graduated in the optics program.
If you had a son or daughter in high school, what advice would you give them?
Look around, find something that you like, do it well, and hang in there with it.
Study your geography so you know where the countries are when someone comes from a country you're not familiar with and wants to send a package back home at Christmas time.
I love cooking. I love cooking healthy food. I love cooking for people, period. And this is a good place to cook for people because it's a big volume of people here.
Why did you want to become a cook?
I first wanted to become a cook when I was in high school, and it was something that I enjoyed doing. Later on in life, as I got to do it, I like the way the work is done, the healthy food for the patients, and everything else. So this is why I cook.
What type of advice would you give to somebody who wanted to be in this profession?
I would say make sure that this is what you want to do, because it's a lot of work, but it's fun work.
So how long have you been in Strong Hospital?
I've been working here for 18 years. When I first started off, it was just the basic tray line, cooking the food and serving it. Now we're more so into a room service where we more so design the food and it looks more better, more attractive, and people tend to love it better. And if they love it better, then I enjoy what I'm doing, so I'll do it better.
If you are interested in healthcare, this is how you have to prepare.
Stay in school and get good grades.
Stay at your job for at least 6 months.
Talk with a school or career counselor.
Talk to somebody who has a job that you're interested in.
Check out websites and other information about health careers.
Check out financial aid options.
Get some work experience in the hospital.
Some of the benefits of a healthcare career are
tuition reimbursement,
on-the-job training,
job security,
good salaries,
excellent career advancement.
We work together in healthcare, making a difference in people's lives, and we need people like you to join us.